People call me Lolo One. I would be your host for today's event. Some say Adako. I see Mama saying Adako. All right, put your hands together. Thank you. You know, I don't bring Adako with me to events like this. These are English-speaking events. And in these kinds of events, they don't serve a bar. They give you only tea and things that do not fill you up. So we're going to leave Adako outside while Lolo takes over for today. But in case they decide to extend it to afternoon, then she would have to make an appearance. Thank you very much for acknowledging us. We want to thank all our guests for making time to come on time, because that's another great thing to do in Lagos, to have an event that would be starting at a time and people actually come at the time allocated. I want to especially celebrate one of our special key guests today. I am particularly impressed by his timekeeping abilities. So by the time when I call him, you have to give him a rousing applause, please. A rousing applause, because out of his busy schedule, he has made time to be with us today. And not only did he make time to be with us today, he came on time. Please help me to celebrate the very special gentleman that is with us today, the Permanent Secretary, Lagos State Ministry of Health, Dr. Segun Ogboye. We appreciate you, sir. And we know that anytime Dr. Ogboye speaks, I am going to stand attention, because I know that he's a man of his word. And this shows the commitment that Lagos State has towards the health sector. Thank you very much, sir, for coming. We appreciate you immensely. Thank you. And also, we would be acknowledging one of our big support in the person of Rodio Diallo, the Interim Deputy Director for the Optimized Family Planning Interventions, and also the Bill and Melinda Gates Foundation. The Bill and Melinda Gates Foundation is a co-funder for the Post-Pregnancy Family Planning Project. The organization strives to reduce inequity and also ensure that women in low-wealth communities have access to family planning services. Rodio Diallo is a very passionate person about family planning and also supervises the foundation's family planning portfolio here in Nigeria. Please help me celebrate Rodio Diallo, our Interim Deputy Director. Thank you. She's not here present with us, but she will be joining us online, so please acknowledge her when they come. We have some of our key guests that are not here, but we would acknowledge the ones that are here presently. I'd like to celebrate the Director, Medical Services and Disease Control, Lagos State Primary Healthcare Board, in the person of Dr. Eniola Eriosho. Thank you very much, Dr. Eniola. I'm told she's here. Okay, we celebrate you. Thank you very much for coming also. We'd also like to celebrate the Portfolio Director of JHCCP Nigeria, Dr. Mojisola Odeku. Thank you very much, Ma, for coming. We appreciate your presence here with us. Also, the Chairman, Association of General and Private Medical Practitioners of Nigeria, Lagos State Chapter, in the person of Dr. Makinde Akinlemibola. Thank you very much for coming. We appreciate your presence. Thank you, sir. Also here with us today, we have the Chairman, Family Planning Providers Network, FPPN Lagos State Branch. Please celebrate with me, Dr. Difu Madu. Thank you very much, sir. I had the privilege of sharing the breakfast table with Dr. Madu. Nice gentleman. All right. We also have the Director of Post-Pregnancy Family Planning Project, Dr. Taiwo Johnson. Thank you very much. Yes. I've interacted severally with Dr. Johnson. Thank you. Also with us today, we have the Technical Officer Service Delivery for Post-Pregnancy Family Planning Project. Please celebrate with me, Dr. Omotunde Odaye. All right. Okay, I see her. I see her. I was just trying to catch her in the crowd. All right, with us here today is the Program Associate, Post-Pregnancy Family Planning Project, Mercy Ehimidu. Where's the beautiful Mercy? Okay, I see you right at that corner. Thank you very much. All right, we'll just be moving very quickly into our agenda because we'll not like to keep our permanent secretary too long. Please help me celebrate Dr. Chegwo Boye as he comes for his opening remarks. Thank you, sir.
Good morning, everyone. I'd like to acknowledge our guests, particularly Rodio Diallo from the Bill and Melinda Gates Foundation, Dr. Odeku from the JHCCP, Dr. Eriosho from the Primary Healthcare Board, Dr. Makinde Akinlemibola from the AGPMPN, Mr. Clement Olainfa from the AGPNP, Dr. Difu Madu from the FPPN, and all our distinguished guests who are here as well. In 2012, Nigeria as a country committed to the Family Planning 2020 Declaration, aimed at ensuring that 120 million women from the world's poorest countries have access to voluntary family planning services. To achieve this, our government set a target for contraceptive prevalence rate, which was then adjusted to 27% by the year 2024. Lagos, being the most populated state, had a target of 74%, and we're currently at 49.1, with an annual increase of about 0.5%. So, I mean, with the figures we're getting, it became clear to us that we needed to support or involve more strongly the private sector in Lagos, who cater for about 65% of our population. And in trying to do this, with the support of our development partners, we've been trying to implement relevant policies and strategies, including a task-shifting policy for service delivery. One of the interventions is the implementation of the post-pregnancy services, which has been harmonized into the state's costed family planning implementation plan. The Johns Hopkins Center for Communication Programs, led post-pregnancy family project, is strengthening this intervention in the private sector through creating demand and service delivery, as well as providing technical assistance to the state. Post-pregnancy family planning is one of the proven high-impact interventions aimed at integrating family planning into the existing health services, and if effectively incorporated, can enhance the family planning uptake in the state. It is a key intervention aimed at ensuring a woman receives adequate rest of at least 2 years before the next pregnancy, in line with the World Health Organization's recommendation. Evidence has shown that maternal and newborn mortality increases when pregnancies are not too frequent and inadequately spaced. The state government is supporting this initiative by opening channels to ensure the availability of family planning commodities to the private sector providers, conducting quarterly supportive supervision and data quality checks. One of the things we are also trying to do now is also supporting private care providers at the lower end of the scale that are providing services to the poorer women with even all the complete package of consumables that they will require to provide this service, so that it will be truly at no cost at all to the women. The state has also trained health providers across the state and in the private sector on family planning services, developed and distributed family planning job aids and materials, and conducted last-mile distribution of family planning commodities across the state to ensure it gets to the end users, inclusive of the private sector providers who are registered by HEFAMA. which is the agency of government that registers and monitors private hospitals. The state, supported by the Global Fund, trained all health facilities, public and private, in the state, providing maternal and child health services on the use of the newly revised HMIS tools. For the state government, the COVID pandemic came with many challenges, and this also affected the provision of family planning services. It prevented a lot of the women coming to access the services. It affected the distribution of supplies to the centers providing the services. And so it reduced the supply of commodities generally to the state. We have recently received approval from the governor to procure additional family planning commodities, especially those that have been out of stock. I would like to use this opportunity to appreciate the Bill and Melinda Gates Foundation and MSD for Mothers for their unwavering support to Lagos State and their commitment towards ensuring women are provided with voluntary and quality family planning services. I want to reiterate the commitment of the state government to ensuring that the interventions are sustained and every Lagosian has access to quality and comprehensive family planning services, especially in the private sector. I would like to also remind us that currently there's an maternal, neonatal, child and adolescent health week going on, and family planning services is one of the core pillars of this intervention. This week, we are taking it all around the state to let people know that these services are available and they will continue beyond the week, but only that people have to then come to the health facilities to access them. So, as I said, we are committed to this, and the ministry will be putting all its support behind the program. Thank you very much.
Thank you very much, Dr. Shego Boye. We know that he probably has other engagements, so before he leaves, we'll just crave his indulgence to allow us take some pictures with him before he goes. So please, sir, can Dr. Boye please come? And all our doctors seated across the tables, please join him for a photo op very quickly. They could just line up and take a quick picture with our PS Health. Dr. Muji, Dr. Odeko. I wanted my own private photo op when the PS is done. Dr. Madu, Dr. Madu, you'd have to squeeze in between so that, please, can you make a little, sorry. All right, we'll continue with the agenda, and while we allow our very special Dr. Ogoye to exit the hall, put your hands together for him as he exits. We will continue with the program, the agenda, by listening to the welcome remarks by Rodio Diallo. Thank you.
Good morning, everyone. Representatives and colleagues from the Lagos State Ministry of Health, Lagos State Primary Healthcare Board partners, representative of MSD for Mothers, dear colleagues from the private sector health associations and private facility owners, colleagues from GHU, CCP, and the consortium member, CCSI and ARF, and all my implementing partners present at this event. I am pleased to be with you today for the Post-Pregnancy Family Planning End of Project Dissemination Series. This project was designed following the request from the Lagos State Ministry of Health and in partnership with the Bill and Melinda Gates Foundation and MSD for Mothers. It is successfully implemented by the consortium ably led by GHU CCP with ARF and CCSI. Looking at the data, PPFP in the private sector in Lagos was really the low-hanging fruit to accelerate FP uptake in the state, given that from the 2013 NDHIS that we used to design this project, 80% of newborn were delivered in facilities in Lagos, while a high proportion of women, up to 84%, presented for postnatal visit. And this is 2013 data. And at that time, we saw that the state could accelerate its path towards its FP goal by investing and supporting the private sector. The project was implemented in the private sector, which accounts for over 3,500 registered facilities, which provides services to a great number of the citizens in the state. To increase modern contraceptive uptake among women seeking services in the private sector, GHU CCP and its consortium members designed the project, blending data-driven advocacy, demand generation, and service delivery strategies, while also leveraging the key learnings from the HSDF-led MNCH grant, the Newborn Health Quality Improvement NHQI, which focus on improving quality of newborn and maternal care around the time of birth. And that was a great way to connect the dots to leverage the learnings from a previous investment. Post-pregnancy family planning is one of the high-impact interventions that protects and empowers women and provides them with information and services that will improve their well-being and that of their children. And to reach its family planning goal, the state needs to harness the potential of PPFP in the private sector, using rigorous data to inform their programming. And through an excellent partnership with the private sector health associations and clinic owners, the consortium adopted a flexible and nimble approach, achieving key milestones, including, among other milestones, the integration of family planning services along the MNCH continuum of care in over 236 private health facilities, a significant reduction of stock out of commodities from 95% stock out down to 30% by providing multiple options for the supply of commodities, and reaching out over 172,000 women with post-pregnancy family planning services, providing modern family planning method to over 31,000 new acceptors, and building the capacity of about 1,000 private sector health workers on post-pregnancy family planning. To sustain the gain from the project, we hereby would like to share a few asks for the state and all the actors to consider. As donor resources continue to dwindle, the state should strive to commit domestic fundings for family planning commodities and extend their reach to cover the private sector providers' need, given their huge footprint in serving women in Lagos. The state needs to further the engagement of the private sector on reproductive health policies and strategy. This will contribute to providing an enabling environment for family planning services in the private sector to ensure PPFP services continue to be offered and the data collected to reflect the contribution and to give a more accurate health snapshot of the state. We hope that the state also will disseminate the post-pregnancy family planning strategy and ensure its inclusion in the cost implementation plan. And we think that the mid-year review of the cost implementation plan offered that opportunity. Finally, there is a need to enhance collaboration between the private and public sector health provider through the family planning provider network to strengthen referral networking, but also to do the right policy change to harness the potential of the private sector. We would like to take this opportunity to thank the Lagos State Ministry of Health leadership for the constant support and partnership during this project implementation. Our gratitude goes to all the Lagos private sector partners, health association, who embraced this initiative to contribute to the state's family planning goal. Finally, we thank the GHU CCP team and their consortium members, including ARF and CCSI, for the excellent work, flexibility, and results-driven approach implementing this project. Thank you all.
Hello. All right. Thank you. Put your hands together again for Rodeo Diallo. The end of project dissemination meeting, it brings back good memories of all that has gone down while the collaboration was ongoing. A lot of successes has been, seen through this marvelous project. Right now, we have one of our contributors. She's going to be giving us a welcome remark from online. Please help me welcome Country Director for MSD for Mothers, Yaduni Olubode. She will be joining us online. Thank you. Just in a minute, we're trying to connect with Mrs. Yaduni Olubode. Is she ready now? 2 more minutes. We thank God for the marvels of technology. Now we can conveniently have meetings and not be inside to be able to have meaningful contributions. That's really an excellent addition to our generation. Have we connected? After Yaduni's welcome remarks, we still have welcome remarks from our portfolio director, JHCCP Nigeria, in the person of Dr. Mojisola Odeko. She will be giving us her welcome remarks too, just in a few minutes. If we're still having trouble connecting, should we take Dr. Mojisola first? Are you ready? We should take Dr. Mojisola. All right. While we wait for the connection to come through, we will use this time to take our portfolio director's welcome remarks. Please put your hands together for Dr. Mojisola Odeko as she comes. Is she ready now? Just signal to us so that we can know. I'm waiting for a signal. I think while we wait for the connection, Dr. Mojisola can please come and do her welcome remarks. Put your hands together for our amiable, wonderful mother as she comes. Thank you, ma'am.
Thank you very much, my amiable, admirable. I'm one of your fans. Every Sunday, I watch you on, that program now. For those of us who watch the program. Do we know the program? So it's indeed a great pleasure. Apologies because we would have had the second donor speak in line with protocol. And so once the technology comes on, Iyaduni from MSD for Mothers, who co-funded with Rodeo Diallo of BMGF, would admonish us and give us welcome remarks. Well, it's indeed a day of joy and celebration, I would say, as Rodeo has also alluded. If we look at the journey of 4 years, really, and I tell myself, so where did this time go? When we started this journey, we knew there were big aspirations, especially for Lagos State, because Lagos is the landmark for Nigeria and also for Africa, especially with the diversity of the private sector service network that we have and the great contribution that the private sector is rendering to health services in Nigeria. If you are talking of network of private facilities, Lagos has the highest, and we know that. And not in terms of just the number, but also in terms of expertise. You know, if you go down the lane. And of course, we found that most of the contributions of the private sector usually is not well covered, mainly because the data doesn't really go to the center, all right? And so we are actually undermining ourselves by not ensuring that that is well covered when so much work has been done within. Most especially, we also found that family planning services seems to be a bit intangible, even within the maternal health services provided by the private sector. The private sector seemed to focus more on the obstetric side of maternal health. And for us to really have an inclusive maternal health package within the rigor that the private sector provides in Lagos, we thought the missed opportunity, especially within the post-pregnancy period, which is the time between one pregnancy and the other, not just postpartum, because many people just focus on postpartum. That lag time between one pregnancy and the other, where almost 80% visit private facilities, is a missed opportunity that needs to be captured. And that's what actually excited us in designing this program, to show that the private sector clinical is really very important, you know, not just the non-clinical, because it's the non-clinical people focus on. When you talk of private sector, say are non-clinical for family planning, pharmacy and PMVs. And we said, no, you need to unbundle it, clinical and non-clinical. The value of the clinical is because they render almost 70 or 80% of maternal health services in Lagos. So we're excited. It was not a smooth road, but I am excited because the community of practice here present have put their names in the signs of times, and your names are written in gold. Every experience we are sharing today comes from you, and we're excited that we were able to build that partnership that the Lagos State government is also excited about, and use it to be like a landmark for other states to come and learn. So, and rounding up this project is not the end of the journey. So what I'm saying is that Lagos State, of course, has taken over. They are leading, and they will still get back to this community of practice to continue to learn, to continue to share, and most importantly, the data of all the good work we're doing to come up so that Lagos State can really give a robust idea and experience of what is going. Thank you so much for joining with us on this journey of 4 years, for sitting, learning together. We created a lot of things. We had challenges. Even last year when COVID came, COVID did not disrupt us. Remember, we all transited to virtual. Some of us who didn't like technology, we had to learn technology by force, because we were all locked down anyway. So at least that learning also came, and we were able to use technology even to improve our services. So the journey is still far ahead, because we were only able to work with about 236 facilities. Our vision would have been to cover all the facility, and our desire is that Lagos State will mobilize money to be able to do that. And I'm happy that our chief host, Dr. Victoria Omoera, whose table is going to do that, is fully present here. Dr. Omoera, please stand up so that they can all see you. Please stand up. Oh. So she is the one going to make sure it covers everywhere. And I know she's rugged and she will make it happen. Thank you for joining with us and partnering with us, and welcome.
Thank you very much for that wonderful, wonderful remarks. Please put your hands together again for Dr. Mojisola Odeko. Wonderful, amiable woman. All right, at least we'll see whose shoulder the next weight is going to be put on. But we believe that you are more than able to achieve great and greater things. All right, are we able to join on now? Please, let's join with one of our key funders, and that is Iyaduni Olabode of MSD for Mothers. Thank you.
Thank you very much for the introduction. It's Iyaduni Olubode, MSD for Mothers. Distinguished guests, our guests from the private sector, Lagos State supporters who have been very instrumental on this project. I want to acknowledge Rodeo from the Gates Foundation and the team who have worked tirelessly on this project for 3 years. I represent MSD for Mothers in Nigeria. MSD for Mothers is an initiative of the pharmaceutical company MSD, also known as Merck. And the initiative is focused on creating a world where no woman has to die giving life. It appears the sound is, let me try my head. I think it's important to note that what we're celebrating here today began in 2012 when MSD for Mothers and the Gates Foundation jointly committed to supporting the FP 2020 global movement by pledging about $50 million to address family planning. And so why family planning or MSD for Mothers? It's because family planning is considered a highly cost-effective way to reduce maternal mortality, potentially averting up to 1/3 of all maternal deaths by empowering women to plan and space their pregnancies. In Nigeria, there are many women who are at risk of getting pregnant before they're ready. Only 12% of married women in this country use modern methods of contraception. And so like Dr. Odeko mentioned, there's immense opportunity here. Private sector has also demonstrated value because a lot of people seek for care within the private sector. And if we're moving towards universal health care, then they're a critical resource to help us reach more people. And this is why I'm excited at the work that the team has done, working with a lot of support from the Lagos State Ministry of Health, from the private providers themselves, and the extremely energetic and focused team. We're happy to see the increase in uptake in family planning. We're happy to see the private providers integrating and demonstrating their contribution to helping to increase contraceptive uptake in Lagos State. And so I don't want to take too much time. I want to congratulate the team on the work that they have done and look forward to sharing and hearing feedback from members of the audience based on the information that they will share with us today. I think they've set a good foundation that can be carried forward, and we thank Dr. Moira and her team for her leadership as they carry this work forward. We look forward to continuing to see the gains of this investment in our health system in Lagos State carry forward, not just in Lagos State, but as a shining example to other states of what is possible when the private sector and the public sector work together. And so I'll hand the mic back. And I want to say thank you very much for the opportunity. It's been a pleasure working with the team under the leadership of Dr. Odeku and Taiwo, the project lead. Also want to acknowledge Caroline, who is not in the room currently, but she's signed on virtually. Thank you all for bringing your best to this work, and look forward to seeing this work sustain itself and carry on into the future. Thank you very much.
Thank you. Put your hands together for Iyaduni Olubode of MSD for Mothers. Thank you very much. Thank you. All right. Now that we're taking all our welcome messages, all our welcome remarks, now we move on to goodwill messages. And the very first person that will be taking the goodwill message from is the Chairman, Association of General and Private Medical Practitioners of Nigeria, AGPMPN. Lagos chapter. Please help me welcome Dr. Makinde Akinlemi-Bola. He is committed. Yes, the association is committed to taking the association to unprecedented heights, especially within the reproductive health sphere. Thank you, sir.
Thank you very much, Lolo. The Permanent Secretary, Dr. Segun Boye, who has just left us. Rodio Diallo, the Interim Deputy Director. Bill and Melinda Gates Foundation. Iyaduni Olubode, the Country Director, MSD for Mothers. Dr. Mojishola Odeku, the Portfolio Director for JHCCP. Colleagues, I will not fail to recognize Dr. Antonio Molola, our past president in AGPMPN. Colleagues, ladies and gentlemen, it's a pleasure to deliver a goodwill message from AGPMPN concerning this post-pregnancy family planning project. I must say that this particular project, which is of high intervention in family planning, has afforded us in private practice a lot of insight into how to manage our patients. I must also say from the onset that it has afforded us to look at some of the gains that we can have, which might not directly translate into profit for us, but has helped us to not only help ourselves and our patients, but also the society at large. Let me first of all talk about, let me first of all say something concerning the theme of this project, which is to know the facts about family planning
and what other time to be able to catch them other than when they come for antenatal during pregnancy. It's also pertinent that in the process, the patients and even us can talk to the partners of these pregnant women, and at the same time, they will be able to have interaction with a closer interaction with their providers during this pregnancy. And then finally, to be able to go ahead and look and choose the modern way of family planning. I must confess that Johns Hopkins has been able to afford us this opportunity to look into a situation where we are not thinking of the profit alone, but also to develop ourselves in terms of some other things. It has also afforded us, especially those of us in private practice, to build our capacity in another line. Some of our members of staff have gone to develop their capacity, and they have been able to put it to use. But I must also say that at this junction, that we still have a lot of work to do. Inasmuch as in private practice, we take care of 65% of patients. At the same time, this is the way to go in order for us to continue to give quality medical service to our populace. I must also say at this junction that we have just started. This is a catalyst, and it is imperative that we should bear this in mind and continue to ensure that we sustain this progress in terms of family planning. Once again, I want to thank Dr. Omera. I hope I'm correct. I've not murdered that name. For coordinating this project and bringing it to fruition. On behalf of the private practitioners, I want to thank everybody for making this project a reality and looking forward to the future. Thank you very much.
Thank you very much, sir. Please, another rousing applause for him. Thank you, sir. We appreciate your participation. All right, we were supposed to have Director of Medical Services and Disease Control, Lagos State Primary Health Care Board, but she's not here present, but she's sent a representative. So please help me welcome Dr. Veronica Iwayemi to represent Dr. Eniola Iriosho for the goodwill message. All right, she's coming. Please keep clapping. Thank you.
Thank you very much. Good morning, everyone. I stand here today. I'm honored to represent the Director of Medical Services, Dr. Eniola Iriosho, who is unavoidably absent today. And so I will read the goodwill message that has been communicated. The Permanent Secretary, Lagos State Ministry of Health, the Interim Director, Deputy Director, Optimized Family Planning Intervention, Bill and Melinda Gates Foundation, the Country Director, MSD for Mothers, Portfolio Director, JHCCP. Please permit me to stand on existing protocol. I bring you greetings from the Permanent Secretary, Lagos State Primary Healthcare Board, Dr. Ibrahim Mustafa, who is unavoidably absent here today. I have the honor to convey the delight of the Primary Healthcare Board to be part of this closeout dissemination event. for the Post-Pregnancy Family Planning Project. The Post-Pregnancy Family Planning Project, a 4-year project funded by Bill and Melinda Gates Foundation and MSD for Mothers, started in 2017 to help Lagos State government address identified gaps and unmet needs in our family planning service delivery. The overall objective was to strengthen our private sector health providers and to offer post-pregnancy clients the information and services required to commence the use of family planning services. From its inception, the project has been supporting the Lagos State government to increase the contraceptive prevalence rate within the private sector, in line with the FP 2020 declaration. It has worked with our private health facilities to generate demand for post-pregnancy family planning commodities and created a conducive environment for the provision of comprehensive family planning services. Gladly, we have made a meaningful impact on our service uptake in 19 of our local government areas, inclusive of their corresponding local council development areas, and across 230 private health facilities. It is our wish that the collaboration continues beyond 2021, but we are now here at the closeout dissemination. However, our take-home from the sustainability in the long haul is the demonstrated best practices and high-impact strategies that have emanated from this project. The success stories and impacts recorded are many. Our local government family planning managers have built capacity in their engagement and sustenance of oversight roles and responsibilities across the entire 19 local government areas and the value chain for both public and private health facilities. Our data reporting and analytic skills have been empowered with meaningful insights and strategies, all focused on improving service delivery and increased contraceptive uptake. With the change mindset gained from this project, we are optimistic of a steady and sustained increase in family planning uptake from our private health sector. It is hoped that the dissemination from today's meeting will further support the ongoing effort and advocacy from increased access to modern family planning contraceptives. We express our sincere gratitude to the PPFP project team, led by Dr. Taiwo Johnson, which has worked relentlessly in support of the aim, objective, and expected outcome of the project since 2017. We thank the fund providers of the project, Bill and Melinda Gates Foundation and MSD for Mothers, for supporting our vision. We are grateful to our state and federal government for facilitating this collaboration. All our impacts have been meaningful. They have been effective and positive in influencing informed decision-making for family planning amongst our women of reproductive age. We look forward to future, meaningful, human-centered collaborations of this kind. On behalf of the Primary Healthcare Board, thank you for the support and collaborative efforts with the state government. I wish us all fruitful deliberations. Thank you and congratulations.
Thank you very much, Dr. Veronica Iwayemi, for bringing that beautiful message from Dr. Eniola Irionsho. We appreciate it. All right. We still have a couple of goodwill messages to take. This time, it's coming from the Chairman, Association of General and Private Nursing Practitioners of Nigeria, AGPNP Lagos State Chapter. Please help me make welcome Dr. Clement Olaifa as he comes.
Good morning, everyone. My name is Olaifa, Mr. Clement Olaifa. It's my pleasure to be here this morning. The project by Bill and Melinda Gates Foundation has been a very wonderful one. When it was introduced to us 4 years ago, we embraced it and we really have the benefits of embracing it. Before, every health facilities will look at the provision of family planning methods to family and individuals as not profitable to our practice. But as we continue to link with donors from various areas, especially the one that was funded by Bill and Melinda Gates Foundation, we rub minds and we are able to observe very well that there are other gains when you provide the family planning methods to clients. Because actually you may not be charging more or having so much benefit from it directly, but indirectly we realize that we start gaining from it because it makes other clients to come through that introduction of family planning to our health facilities. Another unique area of PPFP that makes me very happy is that they were able to integrate other area of healthcare delivery services, especially when they were coming, they encourage us to be providing, to expand our practice to enable to accommodate immunization. And when we are doing this, providing immunization, you are able to relate with the mothers adequately and ensure that you are able to reassure them that more, because if we all embrace family planning, there are a lot of advantages over it. Many people that were not able to access family planning due to cost. Because of this provision of this project, we were able to provide at a very low cost in the private sector. Sometimes we even have the grace to provide free family planning at the private sector also, not in the government sector. So I want to really thank you for the opportunity that you have given to us to be part of this project and enable the unmet needs in family planning to be closed up. Also, I want to thank the Ministry of Health because whenever there is a means of ending the project, I always have the concern that that may be the end of it. But I think Lagos State is doing wonderfully well. Dr. Omera, I want to really thank you. The other time, I want to also thank the Permanent Secretary because the other time, I think he told me that we should also go and bring names of all facilities that we want to provide family planning, and that all that the donors have been doing, they are also ready to provide the incentives to the hospital health facility. So I think this is a kudos to you. But let me say this. The donors that have been coming to Nigeria, they have been an eye-opener for us to know that private sector should not be pushed aside. Earlier in the past, you will see that we are not being carried along for a lot of things. But since the inception of project donors and every other supporter for various projects, the private sector is now well recognized by government, and we are doing everything together. I think this is a kudos and plus for you. because you started it. So I want to say that we will not allow the project to die. We will continue to do well. Nurses are ready to provide family planning. Even I've contacted a lot of my colleagues, and we are now ready to be providing it at a free. We want to provide free family planning, not even collecting anything for family planning, and that's our determination. And we shall all, generally in Lagos State, start that as soon as possible. I want to thank you for having me. Good morning, everyone.
Thank you very much, Mr. Clement Olaifa, for bringing that wonderful, awesome message that nurses are ready to continually collaborate on this amazing project. It's so important that we keep this alive. It must continue. All right, right now, our next Goodwill message will be coming. But before that time, you have sticky notes on your tables. If you have questions you would like to ask or whatever you would like to say, please write it on the papers on your table. We will, at an appropriate time, take all the questions that you have. Thank you. Right now, we'll be calling on the Chairman, Family Planning Providers Network, FPPN Lagos State Branch, in the person of Dr. Difu Madu, to bring his goodwill message. Thank you, sir.
Thank you very much. Good morning, all. Standing on the existing protocol, the story has been told. We have heard everything. Post-pregnancy family planning. The program has been on for some years now. We all know it. But along the line, this program got pregnant. And delivered. But before delivery, it midwifed itself to a thing we all know today as Family Planning Providers Network. By my definition, it is self-explanatory. Networking. Linking each other. To get to this point, it wasn't quite easy. There was a lot of challenges, obstructions, difficulties. But the providers, the program providers themselves faced the challenges and overcame. Today we are here as network. And we just don't have to take much of your time. The only simple word we will say, we move. Thank you very much.
They say great things come in small packages. At least I know that small pepper, the pepper where. I knew that Dr. Madu had something special. When he sat, we had our tiny breakfast together. He still had something for me to laugh about. Great guy, great guy. All right, another applause for him. All right, I want to thank everyone that has brought us wonderful goodwill messages. I'm sure that the entire team that worked on this project tirelessly, they are very happy to be receiving all these great accolades. If you work on a project and the success is so obvious, it's something you should be proud of the hard work that I know they have put into it. I'm a part of this journey because I did anchor their radio project for them for some time on Wazobia FM, where we had massive engagement with people, women, men, inclusive, on issues surrounding family planning. So well done. Right about now, I'll be calling on one of our in-house persons, our director, one of our directors for post-pregnancy family planning project, in the person of Dr. Taiwo Johnson. She will be giving us an overview of all the project of all that PPFP project has done, all their achievements, their practices, and everything we need to know. Thank you very much. You're welcome.
Good afternoon, everyone. Oh, sorry. Good morning, everyone. The day seems well spent. So in the next 15, 20 minutes, I'm going to be talking about post-pregnancy family planning, what we know as PPFP. However, I'd like to acknowledge those online. Thank you all for joining in, and also thank you all. The hall is full. We are looking very radiant and beautiful. So now, PPFP, where do we start from? So this is the presentation outline, what I'm going to talk about. And as Lolo said, if you have any questions, please kindly write it in this sticky notes, and the ushers will come and take them. So when we define, what do we mean by PPFP? I will start by saying the Post-Pregnancy Family Planning Project, which is funded by the Bill and Melinda Gates Foundation and MSD for Mothers, is a follow-up to the Family Planning 2020 Declaration. I would say now 2030 Declaration, and an opportunity to reduce the missed opportunities in this post-pregnancy period. Now, as all of us here and all family planning stakeholders work towards achieving the FP 2030, because we didn't achieve FP 2020, but we do hope we'll achieve FP 2030. The private sector, as has been said, represents a big opportunity to increase access to a wider range of commodities for these post-pregnant women. Now, when we say PPFP, I know a lot of you, especially those that are not very familiar with the project, when we say PPFP, what do we mean? It's prevention of unintended and closely spaced pregnancies through the first 12 months of life. And we know this 12 months of life is very crucial. Even the World Health Organization has advocated that the woman should wait at least 2 years before the next pregnancy, before getting pregnant, not before the next pregnancy. And this post-pregnancy period is very crucial for many reasons. Number one, the woman is pregnant, and so she has frequent contact with the health system and can also make opportunities that can improve the well-being of herself and her baby. And so the project aims to increase contraceptive uptake and use by these women by ensuring family planning is institutionalized in maternal, newborn, and child health services, which this woman comes to in the health facility. Now, this is our theory of change. This is the theory of change articulates our problems. What do we see on ground? I'm not going to define this very complex diagram, but I'm just going to say a few key things. We noticed there was poor family planning ideation in the private sector, low demand for family planning contraceptive, low family planning client volume in the private sector, lack of clinical skills, lack of profitability because we have to pay our bills. And so the project aims to address all this by creating demand for contraceptive use during the post-pregnancy women. The unique thing about this is these women are already coming to your health facilities. It's just to make family planning more intentional so that they're able to make better decisions. And so the project addressed all this by addressing skills, motivation, even for contraceptive logistics and supplies. And at the end, what do we aim to see? Improved ideation, increased demand for family planning service, increased client volume, increased provider skills and competence to provide a service, and definitely, very important, increased profitability. When we started working in the private sector, what was our criteria? Number one, you must register with Lagos State. It's very crucial that we work with facilities that are registered with the state government and also submit their data, because our data would feed into the states. Must provide maternal and child health services, MD's commitments, and please let's give our MDs a round of applause. They have gone above. We have MDs that have innovated, provided logistics, and they will be recognized here today. And definitely, We also work with facilities that must provide an acceptable quality of maternal health services. Presently, as we can see, we work in 236 private health facilities, except EPE. And the reason why facilities were selected from the HEFEMA list. And the reason why we don't work in EPE was because we didn't find any facility that provides MCH service and are registered with HEFEMA. And also provide in line with all the criteria I earlier mentioned. That's just the only reason. Now, what did we see on ground when we got there? We did some surveys because as an organization, we use surveys to inform our decisions. And so we noticed there was scanty SBCC materials. In fact, there was no material on the timing in the post-pregnancy period. There was paucity of that. Less than 10% of the facilities utilize protocols and guidelines for provision of FP services, weak monitoring and evaluation system, poor data use. Data use culture was very poor. Paper-based data submission, which is very time-consuming. Poor integration. FP was standalone. It wasn't properly integrated in the MCH continuum. We saw a lot of bias. We categorized our bias into 4. There was bias in terms of age, in terms of parity, in terms of marital status, and spousal approval. We saw those. The biases were very clear. There was also a misperception around the timing of contraceptive in the post-pregnancy period. And lastly, even for demand, there was poor perceived need for family planning. Because you would agree with me that a woman that is pregnant, family planning is not the first thing on her mind. She's thinking of how to deliver like a Hebrew woman. But however, we needed to have her start thinking about family planning so that by the time she gives birth, she has made a decision or not. And at the end of it all is an informed choice, voluntary family planning service. And so we adopted the 3-pronged model of the NORI project. And what did we do? Advocacy, enabling environment, demand generation to address issues and create demand, service delivery to strengthen the healthcare system by improving the quality of care. And as I said earlier, research, monitoring, and evaluation was cross-cutting in everything we did. In advocacy, entry into the states, we visited the Ministry of Health. We had meetings with Primary Healthcare Board. Very key for us was the associations. And because these associations facilitated entry into the facilities. In fact, they used their letterheads to write letters to the private health facilities. Let's clap for our associations here. We visited the facility owners variously. We can see a visit there on different implementation modalities. When we identify any gap in the facility, we visited. I always like to say that when working with the private sector, 236 means 336 ideas, 336 processes. And we had to wear different caps for each facility because what worked for one facility would not work for the other. So we noted that, and we had to change our programming with each intervention. We collaborated with the Interfaith Forum for visit to facilities affiliated with religious organizations, and also we participated, a member of the state's technical working group. For demand generation, we developed social behavioral change materials, specifically for the post-pregnancy period, which included videos as well. And we developed radio spots. We trained health workers on providing health talks, even along this MCH continuum. We supported health talks during clinic days. We branded the facilities. Because we are private, we had to work private. We branded them. One thing we realized was private facilities didn't want things on their walls, so we provided magazine racks. So we worked in line with their peculiarities. It was very key for the success of the project. And we conducted social mobilization within the community, attended baby naming ceremonies. However, COVID happened, so that was stopped. For service delivery, as I mentioned, it was very important that we provided quality, ensured provision of quality service. So we trained, we developed job aids and tools, we linked the facilities to the state government for free supply of commodities. Please, let's clap for Dr. Mary and the Primary Healthcare Board. Thank you. We renovated and we equipped 230 private health facilities. And I would say here that the medical directors, as I told, were amazing. We had over 55% of this renovation being co-shared by the medical directors. We supported peer learnings by the FP providers, and we developed quality guides. Quality was very key. Quality is what ensures a client goes and comes back. And I also like to say, when you do well for a woman, she tells 2 people or 3. When you offend a woman, she tells how many? 100. Exactly. So it's very important that you provide quality service, so the woman doesn't come back with a complication or something, and then she'll go back and say, you see that facility, don't go there. So it was very important for us. On research, monitoring, and evaluation, we built the capacity of all health workers on the use of the data tools. We printed and distributed the new HMIS registers. We piloted the use of the mobile DHIs for collection of maternal and child health data in 20 facilities, and we strengthened the use of their data for decision-making. Now, our outcome, what did we achieve? What were our outcomes? These 4 years, what did we achieve? As some people say, kilo by day. For social mobilization, we reached over 171,000 in clinics and in the facilities. 15,000 were referred, and then 13,000 took up family planning method for social mobilization. Ideation. Ideation is, we know ideation is a concept that people's actions are influenced by their beliefs and their attitudes about a particular behavior. So in improving ideation, we got a 6.5 increase in personal family planning advocacy, which means a woman is now confident about family planning and is able to talk about it. There's a 6.2 increase in women who now engage their spouses on discussions about family planning. There was 17% increase around the rejection of myths in the post-pregnancy post-pregnancy period, and a 21.1% of overall self-perceived efficacy to use family planning in the post-pregnancy period. Provider bias. When we got there, as my colleague Omotunde would say, the provider bias was very thick. However, in working with the providers, we're able to reduce provider bias on restrictions to offer IUD to women based on parity by 18%, to reduce provider bias based on marital status to 10%, to reduce provider bias based to offer IUD and implants to women based on age and by 10%, to reduce provider bias to offer short-acting method by 27%, and reduce provider bias to offer short-acting method to women based on marital status by 16%. For health system strengthening, what did we achieve? We had 229 functional quality improvement teams. We trained over 1,000 doctors and nurses on long-acting reversible contraceptives. 300 lower cadre health workers were trained on IPCSC and interpersonal communication skills and referrals. 199 CHUs, in line with the Lagos State tax shifting policy, were trained on injectables, and 236 private health facilities were renovated. One other thing we ensured was to have access to adequate sources of contraceptives. This graph shows the baseline and end line. And we can see in the first graph, 27% had no commodities, no source of collecting commodities when we started. However, by the end line, 0%, which means every facility was collecting commodities from somewhere. From the local government area, we had 17% before commencement of the project, which increased to 28%. From other vendors, which makes up the community pharmacists and the chemists, it moved from 27 from baseline to 28 for end line. And from social marketing organization, which also includes DKT and SFH, it moved from 42% to 55%. So presently, all our facilities have where they collect commodities from. We can see here drastic reduction in stockout. And in working with 236 private health facilities, they were divided in batches for easy implementation. And we can see the different lines, but drastically, one thing you can notice is that we had stockout from like 90-something% reducing to 30%. So there was drastic reduction of stockout in the facilities. quality improvement, very important. This is usually reviewed during the supportive supervision, which is done after training. What did we achieve? Waste segregation, ensuring the 3 buckets dustbins are available for waste, was improved from 38 to 97%. Hand washing, availability of signs, and even hand washing skills improved from 59 to 97%. And the use of the contamination of instruments increased from 42 to 97% as well. Prior to project implementation, the modern contraceptive uptake was 4,000, a bit over 4,000, which increased to over 31,000. FP counseling, we can see a drastic increase from April 2018 to May 2021. There was a gradual increase in the FP uptake along 3 years. Now, we can see here the contraceptive uptake also gradually increased. We have the PP women being the green. So total women is the red line, and the red graph, and the PP women, which is the women that the project is all about, was also gradually increased over the years, from April 2018 to May 2021. Now here we can see that the women who reported obtaining contraceptive in the private facilities doubled. So from the beginning to the end, we had more women taking contraceptive in the private sector during the project implementation period. And use of implants more than doubled from baseline to end line as well. What do we learn? One of the things we learned that data is very important. And we used facility scorecard. So we scored the facilities every 6 months. And this score provided each facility with a real-time access to their data. And so when we showed the medical directors this, it was able to enhance healthy competition amongst facilities and also a drive for improvement. We developed guidelines, provided hard copies and electronic copies, which enrich delivery of quality service. We linked the facilities to multiple options for commodities. We also realized that service delivery alone does not bring about a big change. However, demand generation is very important because many women and the couples, they make decisions before they even come to the facilities. The media materials we placed in strategic locations, mostly in the waiting areas of the facilities, generated interest about family planning and the need to know more. And we had the tagline, "Do you know you can get pregnant soon after delivery?" It was an eye catcher, even in the community, because most women, especially post-pregnant women, are not aware. Step-down training, we emphasized the importance of step-down immediately after the training, and this led to the high uptake, the high number of providers that were trained on family planning. And as I mentioned, the use of clinic data was key in ensuring ownership because it's their data. Some of them were like, "This is not my facility data." Like, "Sir, it's from your records." And we emphasize not documented, not done. So if your staff doesn't document a record, it cannot be collated and used. What are our sustainability plans? The operational guides. Now, we strengthen, Dr. Madu has been here, the strengthened link between the clinical and non-clinical private sector for collaboration, for networking, and for referrals. The electronic copies we have provided to stakeholders. We have facilities that have started printing electronic copies for use in their facilities. For quality improvement measures, and we also developed a website to act as a repository for our resources. What were our challenges? High attrition. High attrition, I would say, is worse in the private sector. And I'm sure you all agree with me. Yes. Sometimes we train providers, they don't go back to the facilities. Sometimes all the providers will leave. And that is why we can see a high number of providers trained, because we had to train, retrain, and retrain. It was very tedious, but we did it. And it got worse, it's even worse now during the COVID pandemic. Now, this issue of HMO is still an issue. And we're hoping the government here we know there's a lot of talk going on about it, but there needs to be more talk, especially for clients that have paid for HMO, and family planning is not included. So, because we deal with post-pregnancy women, we always advocate breastfeeding. And so most of them pick the option of lactational amenorrhea method as a form of family planning, which is okay if they follow the 3 criteria. But we realized that the transition after 6 months, when it's no longer effective, to another family planning method is very slow, which sometimes, because it's not well implemented, leads to pregnancy. So that transition is very slow. Tax shifting policy is still an issue, not necessarily among the CHUs, even among health workers like nurses. We have facilities where the nurses have been trained, but they are not being allowed to provide family planning service. I would like to say here that in the public sector, it's the nurses that provide family planning services. I'm sure Dr. O'Meara will be a witness of that. One other thing is dissemination of adopted strategies and best practice to the private sector. Moving into the private sector, there's some things you would see that is not even in practice in the States. So there needs to be that communication channel where policies are adapted from the federal, it cascades timely to the private sector. In conclusion, so the post-pregnancy family planning projects is in the private sector is crucial, is a quick win, is a low-hanging fruit, and it impacts on other components of maternal and child health services. Now, the project has generated evidence that it works for better programming in Nigeria. Investing in this PPFP during the maternal continuum is very crucial and is a vital strategy to impact change. And I'll end by saying it has been accepted as a fact that the availability of family planning services saves lives. We all know that. Where women have access to these services, children and their families are healthier and the society at large benefits. Thank you very much.
Please clap for Dr. Taiwo Johnson. If that is not progress, then I don't know what progress is. Please put your hands together for them. Amazing work. And I know that they have done quite a lot, but there is still so much to do. So, of course, support and partnership is still very, very needed for them to continue to meet all these great targets that they've set for themselves. Thank you so much, Dr. Johnson, for bringing us the overview of the work in the past years. Please, if you have questions, please write your questions down. Signal to our ushers. They will collect the questions, then we would attend to it appropriately. Right about now, we have a quick video documentary that will show you video evidence of most of the things that Dr. Johnson has said. So please enjoy this video clip with us, showing you all the work that they've done in the past years. Thank you.
Although before then, I'll be hearing this thing of family planning that when you take family planning, you'll be able to give birth again. It used to spoil the immune system. Some persons say it will make you get fat.
One of the things we met on ground when we came in was low awareness and demand for post-pregnancy family planning services. And post-pregnancy women were going to the facilities. There were missed opportunities because they were not being provided with family planning service because they were pregnant or because they were within that first 12 months after delivery. However, the project was very intentional about making sure that this group of women are provided with the information and services they need within that time frame.
He said, okay, let's go for family planning. Because after birth, I think after birth, make sure introduce family planning to him. He does not have any problem with that. He bought the idea. My mother-in-law that was with me bought the idea, was like, go for it. So, and I came.
Family planning, in fact, I trust them because I love family planning like mad because single mother me. If every moment
and life has been sweet. You just have fun with your husband, not trying to check the calendar to see when was the last mess or stuff like that, or scared of pregnancy and the rest. So life made easy with family planning.
Working with the private sector, I would say, has been very interesting. And one of the things we've had to do as a project is to ensure that we wear the private sector cap when we're working, engaging them and working with them.
When PPFP came, there was an initial assessment of what we had on ground and what we were doing currently. Yes, at that time, we we're offering some level of family planning to our clients who were interested in taking up the update. They looked at our books and they looked at what we were offering. They told us that we could do much more.
We were limited to IUD, injectable, and tuber ligation, which is once in a while. But once PPFP came on board, we have all methods of family planning as far as this facility is concerned. And our uptake has increased, let me say, from 20 to 70% since PPFP came on board.
So as a project, we started with sustainability in mind. This is because, as we are aware, a project has a timeline. So it was very important that we ensure that we institutionalize best practices even within the project time frame, and also implement activities that can outlive the project. And in doing this, I can say that our best practices are under two thematic areas as well. Under service delivery, one of the things we did was to ensure that once we train a provider, the provider goes back and trains other providers in the health facility. Because as you know, as a project, we couldn't train everybody, but we put structures in place, and we also provided them with materials and models and technical support to ensure other health workers in the facilities are trained.
We were trained on providing long-acting reversible contraception. Myself and the nurses were trained on, and the health extension workers were also trained on short-acting methods and community engagement. And so first of all, the training was phenomenal. There was a lot of engagement. We had the opportunity to both listen to lecturers, engage in conversation in small groups, as well as practice. And I think the practice was just, that one just sort of opened a whole new dimension of how to do things. So, and then we went to nearby primary health centers and spent time with the nurses who had previously been trained. And they have given us the opportunity to keep coming back to see and to work with them on inserting different contraceptive devices for women. So yes, we were trained very well.
Apart from that, we also provided them with electronic and hard copies of all the service delivery materials. We provided the private facilities, and we also gave the state just to ensure that they are able to print more materials even when the project leaves. For demand generation activities, one of the key things I would say is ensuring that family planning institutionalized along the MCH continuum of care. And we needed to ensure that FP Health Talk becomes a norm during clinic days. And it is also spoken about regularly. And these women hear about regularly. And to aid this process, we developed health talk guides, we developed materials, we developed to-do guides, we even developed audiovisual materials just to ensure that the woman, when she comes for clinic days, hears about family planning, and also the provider is also able to ask her questions about family planning services.
For me, using a tool that took me into an area where there were many gaps in my knowledge, or you don't realize that there are gaps in your knowledge until you actually get trained, I found that using a counseling support tool was helpful.
So antenatal and suffering pay family planning after 3 months family planning implants jade o si apa mi sanra inú mi ò tóbi mi jo mo ṣe pé mo jo pé kíní bí mo ṣe wà náà ni mo ṣe wà mo dẹ̀ wà okay pẹ̀lú ẹ̀.
We have a very high attrition rate in this sector. Sometimes we do train health providers, and once we train them, they leave, they don't even go back to the facilities. And what we've tried to do is just to ensure we have different modalities of training. We do what we call the in-facility training, and we just ensure that the trained provider trains other health workers immediately she's trained. And this ensures there's a crop of health workers within that facility that provides family planning service.
Lagos State, being a peculiar state, a lot of people, a lot of our population patronize the private sector. And for PPFP to have come in within that space, which has been a major gap, for the state, it has actually assisted the state in moving our mileage to the next step in terms of integrating the private sector into family planning services.
Each private facility has what the uniqueness and what they provide, what they bring on the table, and they also have their different structures and processes that have worked for them. So going into the facility, we're very careful to ensure we don't disrupt the flow, and we work within the nuances of what already works for them in their facility.
Since then, they link us with place where we can get commodity, so we'll be able to do more awareness about the family planning. we are rest assured that at least if you have many patients coming for family planning, we have commodity to use for them.
Something we gained. So it wasn't just technical know-how, especially for my staff. It was also material donations and here and there. In fact, in almost every room, several rooms in the facility.
A lot of private sector providers don't believe that family planning is very profitable. And what we've done is to link them with various options of supply. So they don't have just one vendor they're collecting commodities from. We've linked them to the state and our 2 different social marketing organizations just to ensure there's a range of commodities they can collect. And we believe this has helped us to reduce the stock out of family planning commodities within the sector. However, as a project, we've tried to engage them and let them know the importance of having all the stocks of commodities just to ensure that a woman comes in and receives her method of choice and also reduce missed opportunities among these post-pregnancy clients.
As in sandboard, wọn green tó máa ń gbé síta ibi tó bá ti rí àmì green sandboard yẹn, àwọn èèyàn náà lè wọ ọbẹ̀. Ibẹ̀ ó dá mi lójú pé ibẹ̀ náà wà òkè. A máa ṣe test fún wọn, wọ́n máa mọ èyí tó máa bá wọn lára mu.
PPFP came and said they wanted to do a makeover. They brought their technical people, they looked around and then they decided, okay, this is what we wanted to do. It just gave us a new look overnight.
Facility owners were motivated to divert very needed resources into family planning in terms of ensuring proper clinic setting, step-down trainings, availability of commodities, and even time dedicated to ensuring trainings and step-down trainings. This generally led to improvements in the quality of services provided in terms of audiovisual privacy, infection prevention, and then competence of the people providing the services. Much more, it generally increased the family planning awareness and demand for family planning services in these hospitals.
You know, when you are engaged by PPFP, the first thing they want to do is to get a guarantee that you're ready to go the journey with them. And they tell you what the basic standards will be. And for some of them, they've been very happy to have their makeover sessions, which is where they help in refurbishing the facility to ensure that it looks pleasing to the clients who come. And they've been able to do that in the private sector for us, not just to say that I'm coming in here because the place looks nice, but I'm coming in because it looks nice. Quality of service is excellent. You get treated right. And then follow-up services are also good.
There was high level of collaboration between the facilities and the project in terms of planning and implementation, and most of the facilities actually co-shared in the cost of renovations and equipment procured.
AF was one of the implementing partners on the PPFP project. Roles on the post-pregnancy family planning project centered on service delivery and quality improvement intervention in 236 private health facilities in Lagos. AF mandate keyed into the overarching objectives of increasing proficiency and also expanding the total number of private health facilities that will be providing post-pregnancy family planning services.
The post-pregnancy family planning project is a unique project. It ties together the legs of demand generation, the legs of research, and of course the legs of service delivery. The Center for Communication and Social Impact played a key role in executing the project, especially from the demand generation lens. In terms of sustainability, the PPFP project has actually done a lot. It has changed the mindsets of the providers in these clinics, allowing them to deliver what I would refer to as a balanced social and behavior change campaign in terms of being able to provide information from the client center and also from the provider angle.
It's very helpful for the state because in terms of access, the private sector was not where we wanted it to be. So with PPFP coming on board, they have been able to increase access to family planning services in the private sector. Now, access includes things like building capacity of the healthcare workers, establishing linkages to where they will get the family planning commodities, improving quality service within the private sector, and of course ensuring that whatever job is done is always documented, because if it's not documented, then it hasn't been done. So they have been able to increase access and build technical competence in the private sector.
And the fact that they don't just leave them they assist them to ensure that they capture data. And the data, of course, goes into our data capture platform. Their achievement is able to be added onto that of the state.
Before then, we've been doing our manual way of attending to patients, not collating data and other means. But since PPFP came on board, there has been numerous changes. We actually trained how to collate data, how to clerk clients.
By and large, I would say that there's been a lot of quality improvement since we went into this collaboration. I would say that there's been an increase, a tremendous increase in the uptake of family planning. I'd say we've been able to create awareness amongst our patients who normally do antenatal here. I've been able to find out that they are able to get family planning done here with little or almost at no cost for them, cheaper than what we used to do, because we've been able to get more access to the family planning commodities and all of that. And we've also been able to carry out outreaches. We do this quarterly.
Even if the family planning PPFP project is fading off, with the experience, the training we've gotten from PPFP projects, the family planning cannot fade off, especially in this facility.
We've actually done a training on the sustainability as well, where we look at how we can define and measure our objectives and all of that. So with all of that, and knowing that we're not just doing it because of PPFP, but we're doing it because we know the impact that it has made on our clients. We know the impact it's been able to help us to reduce mortality and mobility.
In the last 4 years, the project has worked in 236 private health facilities across 19 LGAs to institutionalize post-pregnancy family planning services along the maternal, newborn, and child continuum of care. Until date, over 30,000 women have taken up a modern contraceptive method, with 58% of them being our post-pregnancy clients. Sustained post-pregnancy family planning services will lead to an increase in the contraceptive rate in the state and ultimately result in better health outcomes for women and their families.
Wonderful. Please put your hands together for PPFP. Oh, it's always gladdening to see what you do put in visual form. That brings us closer. It makes it more real, more tangible, that the work that they have been doing has great impact. I want to acknowledge all our viewers joining us online. I believe there are a lot of people linking up to watch over different platforms. We want to say thank you. If you have questions, even from online, we would like you to just put it on the chat box. We will get the questions out and we would get into answering them. Now for our question and answer session, we have a special, beautiful woman prepared for this. The Technical Officer Service Delivery for Post-Pregnancy Family Planning Project, Dr. Omotunde Odaye. She will be taking our questions right about now. Put your hands together. Okay. She's a client. Exactly. So after this, baby, let's discuss post-pregnancy issues. All right. Thank you very much.
Since I am your client, I think you can do better. Thank you very much. Okay. We have a couple of questions here, and we'd like to acknowledge everyone watching us virtually. Kindly drop your questions in the Q&A on your screen, and they'll be addressed. We have some already penned down, and I will quickly invite Dr. Victoria Omera from the Lagos State Ministry of Health to take some of the questions. You're welcome, ma'am. Please let's put our hands together for her.
Good morning. Permit me to stand on existing protocols. We have a few questions here. I will summarize them into two. We're looking at the issues of sustainability after the program closes out. and the issues of the HMOs not having family planning within their benefit package. And I would like to say that is true for the HMOs. Even with us, within our Lagos State Health Scheme, we only have counseling as a component of the benefit package. But we all understand the need and the reason why we must have a full complement of family planning services. And so for us, starting, because if you want to talk to other people, you need to clean house first. So for us as a state, we've had discussions with the Lagos State Health Management Agency, and we're almost certain, we're not 100% yet, but we're almost certain that before the end of the year, we shall have the full family planning components as a benefit package within the Lagos State Health Scheme. I think for the business side of health, they don't necessarily see family planning as a social economic issue. I think for a long time we've kept family planning within the health sector only, but we need to push it into that business sector. People need to realize that when you have the right number of children you should have, be 2, be 3, whatever it is you feel you can cater for, you're a more productive family. When people are productive, they're the ones who will end up paying tax. They're the ones who will end up being healthier. So you don't spend additional monies on chronic diseases and illnesses and other things. You spend the right amount of money on socioeconomic things like hospitals and facility. So we need to start speaking the business language of family planning. And as a state, we're hoping to take that discussion further into the private sector with the insurance companies who run the HMOs and get them to understand why family planning is an integral component. So that discussion has started. We hope to start with our own LASHMA, and when they understand that even as a state government, we've taken that step, then we'll have more people on board. But we understand it's something we have to do, and there's already work on that. With regards to sustainability, we were part of this process right from the very beginning. We have all realized or acknowledged how important the private sector is to us in Lagos State. And so from the makeovers to the capacity buildings to the monitoring and supervisory roles that have been taken, the state has been part of that process. But going forward, I think it was in May, we still had a strategic session with the private sector looking towards planning. We had senior colleagues on the front table here sitting within that process to say what else can we do within the private sector. Because we understand that people come to the public sector, but if we neglect the private sector, then it feels as if we're only working for the public sector, but everybody has paid tax. It is one family planning program. We don't have a separate program for the private sector or the public sector. It is one Lagos State family planning, and everybody fits into that component. So we're already working with them. We've been building capacity in the private sector. The chairman, AGP, NPN, spoke about the fact that we've had this discussion about providing some form of consumables within the private sector to ensure that this service can be rendered free or at almost no cost also in the private sector. So we're working with them. When it's time to do the competency trainings, our family planning managers at the local government are key to that. And we're also looking at going forward how they will offer supportive supervisory roles within the private sector as soon as when the PPFP program closes out. So in terms of sustainability, we might not get everything right at the beginning, but to let you know that we're here, we're committed to pushing this forward and working along with you. I think the last thing here says, why is the 2020 goal not achieved? Is it the Nigerian factor? Well, the Nigerian factor is also a good factor. Where, believe it or not, Nigerians are some of the most brilliant people on earth. And we can categorically say that we are the family planning sector. We need to all come together to do this work. It wasn't as if we didn't make achievements, because part of what Dr. Johnson just read out has also contributed to the FP 2020. It was just that we didn't meet the targets. But I think it's also realizing the fact that maybe the targets we picked initially were slightly overambitious, and somewhere along the way we had to review those targets. But it's work in progress. We're not going to stop. Family planning will always be a continuum of things. I mean, if you live in Lagos, you know that Every day, so many people come to Lagos. So once you think that you've been to one local government, you've conducted sensitization, that you've built capacity, when you go back in the next month, there's an entirely new group of people who are there. So it's an ongoing thing. The new communities springing up. It's because you're all working very hard. We have more people coming to Lagos. And the more hard work you put out there, the more we'll have people in Lagos and the more work we all have to do. But we thank you all very much for the work you've done. It's a joint process, and as a state government, we will continue to support this process. Thank you very much.
Thank you, Dr. Omoira. We can do better. Please, let's appreciate her. All right. To take another set of questions, I'm going to be inviting Dr. Taiwo Johnson, Director, Post-Pregnancy Family Planning Projects. Please, let's welcome her.
Thank you very much, our post-pregnancy family planning client. So one of the questions says, what is the way forward once the project is ended? Or how PPFP will help the private sector to continue the services once the project is ended? So as a project, one of the things we did was to start with sustainability in mind. And in doing that, we put in structures and we train and we build capacity. I'll give you an example. We provided job aids, and we also provided electronic and hard copies. We trained, and then we also encourage step-down training. So we are putting the processes in. And we are in doing all this, we have ensured that PPFP is institutionalized in your facilities process, because now it's been spoken about routinely doing MCH clinics. And we've seen a stage where now it's the providers, even the medical directors that are giving the health talks. That is all the process of sustainability. And we've also provided you with links independent of us for commodities or access to commodities. I remember when the project started, the people who said, are we giving them commodities? I was like, no. We provide these linkages for commodities. And I believe that these are all structures we put in place. So yes, the PPFP would continue. The project will not continue, but I want to believe that what we've put in place would also continue. Health talks will continue. The capacity strengthening would continue. Collection of commodities outside the project would continue. So I believe that our question is answered. Somebody spoke about the Family Planning Providers Network. So yes, we actually have the chairman, and we have the secretary here, and we have focal persons in various clusters, and we are expanding more and more. So I would say that we link up with the chairman or the secretary to discuss further with them. But we do meet, and we have cluster meetings. In fact, we are planning something big for next month. I won't let the cat out of the bag, but then just watch this space. Will the monthly data team continue on this platform? If not, where will we send the monthly data? Okay, as you know, with the usual practice, you send your data to local government. That is the most important data. Our own data is for us to collect and just to help you monitor your trend. And so the process of sending data to the government would continue. That is sacrosanct. On the platform where you collect for us to just quickly visualize and look at challenges, the RM&E team will get back to you on that. How do we sustain the affordable cost of family planning product from suppliers? Observation is that the prices have gone up. That is why, yes, we agree. And if you, Dr. Mera had also mentioned it, prices are going up. People are looking at domestic funding, but Lagos State government has put down resources to procure. And it's because of people like all you, private sector, which is very important. I would just like to encourage those that are not collecting from the state to do so. But you know what, collecting commodities from the government, you have to submit, there's some documents you must submit. That's one of the reasons why a lot more facilities are not collecting. We're trying to make the process as seamless as possible, but evidence. One of the reasons why forecasting is poor is because people are not submitting their requisition forms. And we hear private facilities saying, but I don't use it. Why will I submit? You need to show what you have on ground. That is the only way the government can forecast. And when Lagos State forecasts, it goes to national, and that informs the national of what to give to the state so there are no shortfalls. And we've been having repeated shortfalls because of inadequate forecasting. The logistics officer is here and the reproductive health coordinator is here. We need to get it right. So if you don't submit your acquisition forms, you'll not be giving commodities. Am I right? Exactly. Because they need to plan. Once you can do that, you would collect. So I hope I have answered that question. Now, lastly, recently we were told from our M&E to stop adding BTL to the monthly data, but the reason was not explained. Why is this so? When I got this, I went to meet Mrs. Falan Williams, who is the M&E officer, head of M&E in the Primary Healthcare Board. So on the DHIS, it's under sterilization. You won't find BTL on the DHIS, and it hasn't stopped, it's continued. However, if you do have any questions, Ms. Falan Williams, please stand up so they can see. Can you wave your hand? You can just ask her. She's in charge of the data at the PHC board. So I believe I've answered the questions with me. Thank you.
Thank you very much, Ma. I will take the last question and then one online. This question goes thus: how do we get a comprehensive record of all happening here for step down to others in our facilities and sister facilities? Okay. Before we leave, I believe that the ushers are going to give us documents and booklets that are a reflection of everything you've heard here. And also online, one of the questions is how everybody online will also get information. So after this event, all supported facilities will also get these booklets and messages and presentations delivered to them. Let's put our hands together for PPFP. Thank you very much for listening. Thank you for your attention. You've been a wonderful audience.
All right, thank you very much, our client. She's done an exceptional job. Right about now, we're going to be calling on Mrs. Aderonke Tayo Olufemi. She'll be telling us more about our collection stuff. So please put your hands together for her as she comes to enlighten us. Our awards is going to be starting just immediately, so please sit tight. Thank you, ma'am.
Good afternoon, all. And I beg to stand on the existing protocol. Well, just to say a little about the process of accessing the free commodities from the public sector, which has been ongoing now since 2015. And when PPFP project came on board, the facilities have also been enjoying this privilege. Well, before I go further, I have a question here. Why is it that the uptake of emergency contraception very low? Well, in the public sector, emergency contraceptives is not stocked, it's not on the contraceptive lists that we stock in the public sector because the state gets the supply from Federal Ministry of Health, and the state has not been procuring before now that Lagos State has just high-marked some funds for the procurement of commodities. So that is why in the public sector, emergency contraception is not on our list. And be that as it may, we have some public facilities where we have some partners working. Perhaps partners do donate these emergency contraceptives to the facilities, they still give it out. And there was a time we got a donation some years back, about 4 or 5 years ago, from the Federal Ministry of Health. That was the only time we have actually dispensed emergency contraceptives from our facilities. But since then, the Federal Ministry of Health has not supplied us. And I don't know if the plan, if the Federal Ministry of Health has it in their plan for the future. But now, we don't stock it. So, on the accessing of free commodities from the private sector, just like Dr. Johnson spoke, it is data-driven. If any facility can give us evidence of uptake or use of the commodities, we will be able to plan, and this is done every 2 months. Family planning is a 2-monthly reporting cycle program in which facilities are expected to report their uptake and the uptake of family planning commodities in their facility in the RIRF form. The RIRF form is the requisition, issue, and report form that does three things. It does the work of reporting. It is also used for issuing commodities, and at the same time, it reports the family planning activities in that facility. When we conduct CLMS training, that is contraceptive logistics management system training, I do stress that the form does not only serve the purpose of requisiting, it also tells us a lot about the facility. When you hold an RIRF form, you are able to deduce from the form what the uptake is like. You can also deduce the clientele of the facility on that form. And also you will be able to, you can even probe by the information provided on the form for the reasons why some of the methods are not really taken in that facilities. You will be able to deduce whether there is capacity gap in that facility. Of course, if a facility is not recording IUD uptake or implant uptake, you will be able to tell if that facility has a trained provider or not. So that is why we encourage the facilities to ensure they submit the RIRF on 2 monthly basis, irrespective of whether the commodities was actually collected from the states or not. Because in the state now, we also carry out capacity building for providers in the private sector. So when you submit this form, we are able to compile list of facilities that needs capacity building. So if these forms are submitted regularly, by the time the state is planning or rolling out programs such as training or supportive supervision, then the private facility will also be included in our plans, because we have come to realize that we really need to collaborate with the private sector if we are to achieve the contraceptive prevalence rate targets, which Lagos State has been working towards. And we hope that the private facilities seated here will start collaborating the more with us in ensuring that necessary information and data are forwarded to the ministry, to the State Ministry of Health, for better planning, so that we can all be able to work towards achieving the CPR goals. Thank you very much.
Thank you very much, Mrs. Aderoke Tayo Olufemi, for that insight provided. Right now, we're getting to the very exciting part. We're going to be collecting awards. Potential awardees, please put your hands together for yourself. Whoa. I hope this award comes with envelopes, because that's the cocoa. Because I've been checking the names on this list. I didn't see Lolo One Hospital there. Wow. You guys don't know that I'm a medical practitioner. The only thing is I practice in my dreams. In fact, I found cure for COVID in my dreams. It's just that they can't pay in real life. So you have to meet me in my dream for your, Abby? I know if nobody supports me, Dr. Madu will. All right. Right now, I'm going to be calling a beautiful, beautiful, lovely, lovely lady. She will be helping us through this process. Please help me welcome Mercy Ehimitu.
Thank you very much. The one and only Lolo One, a.k.a. Adaku. Okay, very quickly, it's the time. And I know we've seen celebrating our successes. Please join me as we give a standing ovation and a round of applause to all our supported 236 private health facilities. Please, I crave our indulgence. A round of applause, a standing ovation to all the 236 private health facilities that the project supported. They have been simply amazing. We saw the results ourselves. Data speaks. Remember our slogan, not documented, not done. And we saw that live here today. Thank you very much. We can have our seats. Okay, these facilities have not only been amazing, and we can see sustainability live through all the presentations today. But some special facilities, every one of them is special. But I must tell you, some facilities went above, beyond, put in the extra efforts, using some predetermined criteria. You know now, we believe in data, not documented, not done. So the names you heard here today are not just something we sat down and collated, but we deliberated on it using predetermined criteria across the various thematics. We considered the demand generation aspect, we considered the service delivery aspect, and we will consider data, which is most important. Okay, while the tech guys are trying to prepare the slideshow, I will let us know what these facilities did. Okay, first and foremost, before we go into the facilities, are the ones for the stakeholders ready? Okay, awesome. Okay, we have some important people to also present some special awards too for their support during the course of implementation. PPFP have been on since 2017, and this is 2021. Without the full support of the states, we won't be here today. Are we ready? Okay. We'd like to invite our portfolio director as she helps us to hand over this very important award to our stakeholders. And for the first one we'll be presenting, we'd like to specially appreciate the Lagos State Ministry of Health for their unwavering support over the years. Please, Dr. Omera, can you help us receive this award on behalf of the Lagos State Ministry of Health? We say a big thank you. Thank you, ma. And next on the list, we'd like to specially appreciate the Lagos State Primary Healthcare Board and the person that will be helping us receive the award, Dr. Ibrahimi. Please help us receive this token of appreciation for all the support over the years. We want to specially thank the Lagos State Primary Healthcare Board for their support. Thank you so much. Really appreciate you. For these next two categories, you will bear with me that without their support, they facilitated entry into these private facilities. They are the private sector proper. We'd like to specially thank the AGP and Lagos Chapter, Association of General Medical Practitioners of Nigeria. We say a big thank you for your support over the years. We are grateful. Thank you so much. Thank you so much, sir. Oh, okay. All right. That's fine, sir.
This award is dedicated to my predecessor because I just came in less than a year ago. And he's been wonderful and very supportive of me.
Thank you. Thank you, sir. Thank you so much for that, sir. Thank you so much. I'm sure he's also watching us online in person of Dr. Akintade. Thank you so much, sir. Okay. For this next set of people, lastly, we'd like to thank the Association of General Nursing Practitioners of Nigeria, AGP Lagos Chapter. We want to say a big thank you. Their passion for community engagement is an understatement. Thank you so much, sir. Thank you so much, Ma. You can have your seat. Okay. Back to where we stopped. We use some predetermined criteria to select these private health facilities. And we've already established all our private facilities are dear to our hearts. We are using today to appreciate just a few, a fraction that have demonstrated this capability to further sustain post-pregnancy family planning services as the project fits. So using criteria from the demand generation angle, service delivery, and the research, monitoring, and evaluation. For their timeliness, accuracy, and completeness of family planning records, we consider this very unique aspect. These facilities have also shown that they have standard quality of comprehensive family planning services available in their facilities. And after the project, they will also still continue. They are known for optimal infection prevention and control. They also have zero stockouts of the 5 categories of family planning commodities. They've demonstrated ownership of optimal in-clinic mobilization for family planning services within their facilities. And these facilities also provide adequate resources for family planning services. I mean, some facilities are already printing their own adapted family planning resources, and they're already using it. I mean, what other way can you describe sustainability other than that? So please, I will invite my amiable Lolo one as we go on to call out these unique facilities and hand their awards. We are going to not be calling each and every one of them so that we will not waste a lot of time, but we'll be calling them in 5s. As we call your name very quickly, you come up to the stage, the 5 people that we call, you take a quick picture and you go back to your seats. Thank you very much.
Put your hands together. You know, I keep saying that small things come in, big things come in small packages. Can you imagine the way she was commanding all of us? Even with her tiny stature. I was wondering that, wow, mercy. Thank God that they are merciful. I would have merciful mercy indeed. All right, so we're going to do this very quickly because of time. Once you're mentioned, please jump on stage. This is a health facility kind of people, so you should be very healthy. I assume. So when we call you, please come upstairs quickly, come on stage quickly, so that we can have a quick photo op because we have 50 to call. The very first is AB 10 Specialist Hospital. AB 10. Okay. Wow, you're tiny. We have Crystal Specialist Hospital. We have El Dunamis Hospital. We have ML Hospital and Graceland Medical Center. Please, can we have Dr. Johnson come? And Dr. Moji, please come. Then we'll have to utilize each of all our special guests very judiciously. I think Dr. Madhu should please join this particular picture. Thank you. Dr. Madhu, please join this next group, first group. Let me get... All right, take the picture. You might need it for embassy purposes. Because Nigerians, everybody wants to japa now. Congratulations. All right, the next set. The next set, we have Isalu Hospital, Matador Medical Services, Modupa Lua Maternity Home, Oak Hospital, Oshutui Hospital. All right. All right. Dr. Johnson, there's no sleep. You are not the wicked, but there's no rest for you today. Dr. Moji, same as you, ma. You told you are agile. You can do all things. I know. I'll create the indulgence of Dr. Clement to please join us. Mr. Clement or Lifer, please join this particular group. Just be smiling through your mask. Don't worry. Thank you very much. Doctor, don't cuckoo lick the stage. Just stay. So that we won't keep moving you up and down. Can we have Promise Hospital? Please keep clapping. Royal Hospital. Sentinel Hospital. Hansel Hospital. And St. Raphael Hospital. Please keep clapping. Keep clapping. For this group, I'll be calling on Dr. Veronica Iwayemi to please join. Please join in this next photo, this group photo. Thank you very much, ma. Congratulations. Thank you very much. The next one, we have Patol Hospital. Please keep clapping. We have Jeffy's Hospital, Crown Hospital, St. Maria Hospital, and St. Mary Hospital. Please keep clapping for them as they come. This time around, I'll be calling on Dr. Makinde. Can Dr. Makinde please help me join this group? For the next group, we'll be calling them in tens. So let's have God's Kingdom of Life Hospital, Delta Crown Hospital, Motayo Hospital, Royal Hospital, Dafe Medical Center, Divine Favor Maternity Home, Solid Rock Hospital, Faith Real Hospital, Uwemedimo Hospital, Asomba Medical Center. All right. Can we come for the photo op? Congratulations. We have Precious Gift Nursing Services. We have Hankard Hospital, Life Fount Hospital, Fasomi Clinics and Maternity, Dunia Hospital, Divine Hill Maternity, Lady Luck Medical Center, Akishayo Hospital, Summit Hospital, and Able God Hospital. Congratulations to our next set of winners. Able God, able God. Shower your people. We want this money. All right, just let 5 people step aside for just a few minutes so that the so that they can enjoy. You have more space now. We've created more space. We have more space now. We just want everybody to show adequately. We apologize for the back and forth. Let's take it in fives. The next five. All right, I'll call the next five. Longin Medical Center, Mother and Child Hospital, UNITA Hospital, P&G Medical Center, and Open Door Hospital. All right. Then we have 5 more to go. All right, thank you very much. We want to keep acknowledging our online community. Please, can you put your hands together for our online community? They are enjoying the event as it's going. All right, the next set of awardees, we have Mercy Stripe Specialist Hospital, Hamadiya Muslim Hospital, Emmanuel Clinic, Hesso Hospital, and Akobi Hospital. Please put your hands together for them as they come. Thank you very much. Yes. Thank you very much, Dr. Mudukwe. We appreciate you. Please, can you put your hands together for all the awardees? Very well deserving. Very well deserving. We have lunch that will be served. So please, everybody should still hang around. Lunch is for 1. What time is it now? 12:45. All right, we would we have 15 minutes before lunch is served. All right, we'll be calling on our Director of Family Health and Nutrition, Lagos State Ministry of Health. Please put your hands together for Dr. Folashade Oludara as she comes to give us the vote of thanks.
Hello. I'm standing between you and lunch, Abby. Okay, so on behalf of my director, Dr. Mrs. Fala, who has asked that I send in her apologies. We currently have an MNCH week ongoing, and a few challenges cropped up that she quickly had to deal with to ensure a smooth continuation of the program. So she sends her apologies and also her sincere appreciation to the PPFP project. It's my duty to say thank you. I can list everybody here and say thank you, because without each and any of the single private facilities sitting here, we won't have added on additional women who have used contraceptive. When you realize that maternal mortality in Nigeria is still very high, and we know that when you use family planning adequately, you can reduce those figures by as much as 30%. You know how important the family planning program is. And so I would like to start by thanking our funders, especially Rodeo Diallo from the Bill and Melinda Gates Foundation and Iyaduni Olubode from the MSD for Mothers Foundation. Without these two groups putting down funding, we won't have seen the PPFP program. So I'd like to start by thanking them. Our portfolio director, we like to say that Dr. Odeku is part of us. She lives in Lagos. So even though she operates out of Abuja, the welfare of the people in Lagos are always what it is she looks forward to, ensuring that women in Lagos are healthy and families are healthy. So Ma, we say thank you very much for your support. You've been with us in the state for so many years now. We look forward to seeing you with a new project. We're always welcome. This is Lagos and everybody is welcome to Lagos. To Dr. Taiwo Johnson and her team, they have been our partners in progress. They have been our friends. They have been our family. And over this past few years, they have been part of our family planning program and family in Lagos State. So we want to say a big thank you to them. To the critical stakeholders in the private sector, AGPMPN, AGPNPN, the providers network, we always like to walk through you and not go to each individual facility, because we know that with the association, we're all stronger together. And so we say thank you so much for your continued will to always work with us in the state. We ask that God will continue to strengthen you and for you to continue collaborating with us at the state level. To our private sector providers, we couldn't have done it without you. So I would ask that you give yourself a resounding clap. If the team had walked into your facility and you said you were not willing to work within this scope, there was nothing we could have done. We would have pleaded with you, because we could easily have said no. So we want to say a big thank you to you. We hope you enjoy these awards. You put them up in your facility, and that the awards going further would strengthen you. Any day you walk through that corridor where that award is, you continue to strive to ensure that sustainability plan is maintained. We say thank you all very, very much. Now, I would like to thank the state team. If the state had not been receptive towards this program, we wouldn't have gotten on board. So I would like to start by thanking our Honorable Commissioner for Health, Professor Akin Abayomi. We're currently having a COVID meeting ongoing, so we have the Permanent Secretary, Dr. Olusegun Oboye, coming to give the opening remarks, but they have to be at that meeting. So we say thank you to him. Our Director, Dr. Mrs. Falashade Oludara, who sits on it, and like she says, you heard her in the video, work not documented is not done. So going forward, we will also like to appeal that the HMIS registers and your contraceptive data logistics tools are also continually filled up. We need evidence to continue working. Evidence must be available to say whether we're going in the right direction or whether we need to retweak the program. So I say thank you to her. And the family planning team in the Lagos State Ministry of Health. And our dear partners at the Lagos State Primary Healthcare Board, they provided a lot of support to capacity building and supportive supervision. So from Permanent Secretary, Dr. Mustafa, to the Director, Medical Services, Dr. Eniola Eriosho, and the FP team and the M&E team at the Primary Healthcare Board, we say thank you to them. This is Lagos. I am not a Lagosian. I've lived in Lagos all my life. We like to say in Lagos, everyone is welcome. as long as you contribute to ensuring that Lagos works, Lagos is sustainable for all of us. So we say thank you all very much for coming. We wish you safe journey as you go back. God bless.
All right, now that we're done with the official side of the program, we want to thank everybody for attending. If you have not taken picture with your plaque, this is an opportunity for you to take pictures. For those that were not able to take pictures with holding their plaques, please, you can come on stage and take your photographs now before lunchtime. If you haven't taken any photos, please come outside and take pictures with your plaque so that you can have it documented. It's very, very important. My name is we'll take it in batches, the pictures. Okay, let's do table by table. All right, to make it orderly, I think I would call them by the way I called them initially, so that there is no disorganization. All right, for those 10 of them, yes. For those who have collected their awards, please don't go anywhere. Lunch is served, and PPFPP is trying to sort out logistics for all of you. So please ensure that you wait to be seen by the team. Thank you. All right, that's the first 10. And please, your folders on your table, if you look into it, you will see your meal ticket there. So please hold on to your meal ticket. It's stapled to your folder. All right. The next set is Promise Hospital, Royal Hospital, Sentinel Hospital, Ansel Hospital, St. Raphael Hospital, Pato Hospital, Jeffy's Hospital, Crown Hospital, Santa Maria Hospital, and St. Mary Hospital. So look into your folders, make sure your meal ticket is there. I quickly went to check mine because I don't want stories that touch. MCs will finish MCing. They will forget that I like rice and stew too. I'll take Dr. Modupe's meal ticket because she's on diet. All right, the next set, we have God's Kingdom Life Hospital, Delta Crown Hospital, Motayo Hospital, Royan Hospital, Dafe Medical Center, Divine Favor Maternity Home, Solid Rock Hospital, Faith Real Hospital, Uwemedimo Hospital, Asomba Medical Center. Can you come for your pictures? I hope everybody has taken pictures, all the hospital represented. If you haven't taken, can I see your hands up? Okay, please. All those who have not taken pictures at all can come now. All those that have not taken pictures at all, please come now. Because I hear some people have taken pictures before. So if you know you haven't taken at all, please come out. Please, can you come very quickly so that we don't keep people standing for long? If you haven't taken pictures before with your plaque, please come out. Yeah, go on. If you haven't taken pictures before, can you come now? All the hospitals, all the awardees. If you have not taken pictures before, can you come now, please? All right. I think we've adequately covered everybody. So for the launch, I'm sure the ushers would see to how we would go from table to table so that it's not rowdy. Thank you so much for having me host your event today. I hope I see you at my next event. God bless you. Thank you.
And make una plan well.
Know the facts. Modern family planning methods are safe and effective. You and your partner can plan when to have a child.
Talk to your partner. Let them know you support using a modern family planning method.
Go! Get a modern family planning method today. There's a method that is right for you and your partner.
Know, talk, go. Get it together. Get it together for a brighter future. This Get It Together campaign is brought to you by Lagos State Ministry of Health and the Primary Health Care Board. Sabi, make una plan well.
Learn correct information about different kind of family planning method. Then they safe and they work well. You and your partner fit plan when una like to born pikin.
Tanda well, make you yarn with your partner. Make them sabi say you support modern family planning.
Oh yeah, waka go color be the better one. We go fit your body today. Cause say we get one way correct for you and your partner.
Sabi the correct thing where family planning they do. Follow talk family planning with your partner.
All right, we did very amazingly for time. So please wait for a few seconds for the lunch service to be put into gear. Use this opportunity to interact with your table, meet some new people. You never know, some great destiny connections can be right here, or business connections. So please exchange your cards, talk to the people on your table, meet some people. It's very important. Thank you.
ní ìmọ̀ nípa ìfètòsọ́mọ bíbí òde òní tó fọkàn ẹni balẹ̀ àti pé ó ń so èso rere, ìwọ àtolólùfẹ́ rẹ lè jọ pinnu àkókò tẹ́ fẹ́ bímọ.
o lè jíròrò pẹ̀lú olólùfẹ́ rẹ, jẹ́ kí wọ́n mọ̀ pé o faramọ́ ìfètòsọ́mọ bíbí òde òní kan.
lọ fún ìlànà ìfètòsọ́mọ bíbí òde òní lónìí. ìlànà kan wà tí yóò bá ìwọ àtolólùfẹ́ rẹ lára mu.
mọ kókó nípa ìfètòsọ́mọ bíbí, bá olólùfẹ́ rẹ sọ̀rọ̀ nípa ìfètòsọ́mọ bíbí, lọ fún ìfètòsọ́mọ bíbí, tó gbogbo ẹ̀ papọ̀ fún ọjọ́ ọ̀la tó dára. Ìkéde ìfètòsọ́mọ bíbí yìí wá láti iléeṣẹ́ ètò ìlera ìpínlẹ̀ Èkó àti àjọ tó ń mójútó ètò ìlera alábọ́dé ní ìpínlẹ̀ Èkó.
Sabi and make una plan well.
Know the facts. Modern family planning methods are safe and effective. You and your partner can plan when to have a child.
Talk to your partner. Let them know you support using a modern family planning method.
Go! Get a modern family planning method today. There's a method that is right for you and your partner.
Know, talk, go. Get it together. Get it together for a brighter future. This Get It Together campaign is brought to you by Lagos State Ministry of Health and the Primary Health Care Board.
Make you sabi, make una plan well. Learn correct information about different kind of family planning method. Then they safe and they work well. You and your partner fit plan when una like to born pikin.
Tanda well, make you yarn with your partner. Make them sabi say you support modern family planning.
Oh yeah, waka go color be the better one. We go fit your body today. Cause say we get one way correct for you and your partner.
Sabi the correct thing where family planning they do. Follow talk family planning with your partner. Waka go do family planning. Get it together. Get it together. Join hand plan your family for tomorrow way better. Now the Lagos State Ministry of Health and Primary Health Care Board, they bring una this Get It Together tori.
ọlọ́gbọ́n kó o sì ṣètò ìgbé ayé tó dára fún ẹbí rẹ.
ní ìmọ̀ nípa ìfètòsọ́mọ bíbí òde òní tó fọkàn ẹni balẹ̀ àti pé ó ń so èso rere, ìwọ àtolólùfẹ́ rẹ lè jọ pinnu àkókò tẹ́ fẹ́ bímọ.
o lè jíròrò pẹ̀lú olólùfẹ́ rẹ, jẹ́ kí wọ́n mọ̀ pé o faramọ́ ìfètòsọ́mọ bíbí òde òní kan.
lọ fún ìlànà ìfètòsọ́mọ bíbí òde òní lónìí. ìlànà kan wà tí yóò bá ìwọ àtolólùfẹ́ rẹ lára mu.
mọ kókó nípa ìfètòsọ́mọ bíbí, bá olólùfẹ́ rẹ sọ̀rọ̀ nípa ìfètòsọ́mọ bíbí, lọ fún ìfètòsọ́mọ bíbí, tó gbogbo ẹ̀ papọ̀ fún ọjọ́ ọ̀la tó dára. Ìkéde ìfètòsọ́mọ bíbí yìí wá láti iléeṣẹ́ ètò ìlera ìpínlẹ̀ Èkó àti àjọ tó ń mójútó ètò ìlera alábọ́dé ní ìpínlẹ̀ Èkó.
sabi and make una plan well.
Know the facts. Modern family planning methods are safe and effective. You and your partner can plan when to have a child.
Talk to your partner. Let them know you support using a modern family planning method.
Go! Get a modern family planning method today. There's a method that is right for you and your partner.
Know, talk, go. Get it together. Get it together for a brighter future. This Get It Together campaign is brought to you by Lagos State Ministry of Health and the Primary Health Care Board.
Sabi, make una plan well. Learn correct information about different kind of family planning method. Then they safe and they work well. You and your partner fit plan when una like to born pikin.
Tanda well, make you yarn with your partner. Make them sabi say you support modern family planning.
Oh yeah, waka go color be the better one. We go fit your body today. Cause say we get one way correct for you and your partner.
Sabi the correct thing where family planning they do. Follow talk family planning with your partner. Waka go do family planning. Get it together. Get it together. Join hand plan your family for tomorrow way better. Now the Lagos State Ministry of Health and Primary Health Care Board, they bring una this Get It Together tori.
ọlọ́gbọ́n kó o sì ṣètò ìgbé ayé tó dára fún ẹbí rẹ.
ní ìmọ̀ nípa ìfètòsọ́mọ bíbí òde òní tó fọkàn ẹni balẹ̀ àti pé ó ń so èso rere ìwọ àtolólùfẹ́ rẹ lè jọ pinnu àkókò tẹ́ fẹ́ bímọ.
o lè jíròrò pẹ̀lú olólùfẹ́ rẹ jẹ́ kí wọ́n mọ̀ pé o faramọ́ ìfètòsọ́mọ bíbí òde òní kan.
lọ fún ìlànà ìfètòsọ́mọ bíbí òde òní lónìí ìlànà kan wà tí yóò bá ìwọ àtolólùfẹ́ rẹ lára mu.
mọ kókó nípa ìfètòsọ́mọ bíbí bá olólùfẹ́ rẹ sọ̀rọ̀ nípa ìfètòsọ́mọ bíbí lọ fún ìfètòsọ́mọ bíbí tó gbogbo ẹ̀ papọ̀ fún ọjọ́ ọ̀la tó dára. Ìkéde ìfètòsọ́mọ bíbí yìí wá láti iléeṣẹ́ ètò ìlera ìpínlẹ̀ Èkó àti àjọ tó ń mójútó ètò ìlera alábọ́dé ní ìpínlẹ̀ Èkó.
Sabi and make una plan well.
Know the facts. Modern family planning methods are safe and effective. You and your partner can plan when to have a child.
Talk to your partner. Let them know you support using a modern family planning method.
Go! Get a modern family planning method today. There's a method that is right for you and your partner.
Know, talk, go. Get it together. Get it together for a brighter future. This Get It Together campaign is brought to you by Lagos State Ministry of Health and the Primary Health Care Board.
Tech volume. Learn correct information about different kind of family planning method. Then they safe and they work well. You and your partner fit plan when you like to born.
Please note that there is more than enough lunch for everybody. Please be patient with us as we take it table by table. Please, so that it will be very organized and it will be rowdy. Please. Let's just stay put. We are getting there. You agree with me? We did wonderfully well with time. Thank you so much once again. I think table 5 is getting ready.
Now the Lagos State Ministry of Health and Primary Health Care Board, they bring una this Get It Together tori.
ọlọ́gbọ́n kó o sì ṣètò ìgbé ayé tó dára fún ẹbí rẹ.
ní ìmọ̀ nípa ìfètòsọ́mọ bíbí òde òní tó fọkàn ẹni balẹ̀ àti pé ó ń so èso rere ìwọ àtolólùfẹ́ rẹ lè jọ pinnu àkókò tẹ́ fẹ́ bímọ.
o lè jíròrò pẹ̀lú olólùfẹ́ rẹ jẹ́ kí wọ́n mọ̀ pé o faramọ́ ìfètòsọ́mọ bíbí òde òní kan.
lọ fún ìlànà ìfètòsọ́mọ bíbí òde òní lónìí. Ìlànà kan wà tí yóò bá ìwọ àtolólùfẹ́ rẹ lára mu.
Mọ kókó nípa ìfètòsọ́mọ bíbí. Bá olólùfẹ́ rẹ sọ̀rọ̀ nípa ìfètòsọ́mọ bíbí. Lọ fún ìfètòsọ́mọ bíbí. Tó gbogbo ẹ̀ papọ̀. Tó gbogbo ẹ̀ papọ̀ fún ọjọ́ ọ̀la tó dára.
Ìkéde ìfètòsọ́mọ bíbí yìí wá láti iléeṣẹ́ ètò ìlera ìpínlẹ̀ Èkó àti àjọ tó ń mójútó ètò ìlera alábọ́dé ní ìpínlẹ̀ Èkó.
Sabi and make una plan well.
Know the facts. Modern family planning methods are safe and effective. You and your partner can plan when to have a child.
Talk to your partner. Let them know you support using a modern family planning method.
Go! Get a modern family planning method today. There's a method that is right for you and your partner.
Know, talk, go. Get it together. Get it together for a brighter future. This Get It Together campaign is brought to you by Lagos State Ministry of Health and the Primary Health Care Board.
Sabi, make una plan well.
Learn correct information about different kind of family planning method. Then they safe and they work well. You and your partner fit plan when una like to born pikin.
Tanda well, make you yarn with your partner. Make them sabi say you support modern family planning.
Oh yeah, waka go color be the better one. We go fit your body today. Cause say we get one way correct for you and your partner.
Sabi the correct thing where family planning they do. Follow talk family planning with your partner. Waka go do family planning. Get it together. Get it together. Join hand plan your family for tomorrow way better. Now the Lagos State Ministry of Health and Primary Health Care Board, they bring una this Get It Together tori.
Kó o sì ṣètò ìgbé ayé tó dára fún ẹbí rẹ.
Ní ìmọ̀ nípa ìfètòsọ́mọ bíbí òde òní tó fọkàn ẹni balẹ̀ àti pé ó ń so èso rere, ìwọ àtolólùfẹ́ rẹ lè jọ pinnu àkókò tẹ́ fẹ́ bímọ.
O lè jíròrò pẹ̀lú olólùfẹ́ rẹ, jẹ́ kí wọ́n mọ̀ pé o faramọ́ ìfètòsọ́mọ bíbí òde òní kan.
Lọ fún ìlànà ìfètòsọ́mọ bíbí òde òní lónìí. Ìlànà kan wà tí yóò bá ìwọ àtolólùfẹ́ rẹ lára mu.
Mọ kókó nípa ìfètòsọ́mọ bíbí. Bá olólùfẹ́ rẹ sọ̀rọ̀ nípa ìfètòsọ́mọ bíbí. Lọ fún ìfètòsọ́mọ bíbí. Tó gbogbo ẹ̀ papọ̀. Tó gbogbo ẹ̀ papọ̀ fún ọjọ́ ọ̀la tó dára.
Ìkéde ìfètòsọ́mọ bíbí yìí wá láti iléeṣẹ́ ètò ìlera ìpínlẹ̀ Èkó àti àjọ tó ń mójútó ètò ìlera alábọ́dé ní ìpínlẹ̀ Èkó.
Sabi and make una plan well.
Know the facts. Modern family planning methods are safe and effective. You and your partner can plan when to have a child.
Talk to your partner. Let them know you support using a modern family planning method.
Go! Get a modern family planning method today. There's a method that is right for you and your partner.
Know, talk, go. Get it together. Get it together for a brighter future. This Get It Together campaign is brought to you by Lagos State Ministry of Health and the Primary Health Care Board.
Make you sabi, make make una plan well.
Learn correct information about different kind of family planning method. Then they safe and they work well. You and your partner fit plan when una like to born pikin.
Tanda well, make you yarn with your partner. Make them sabi say you support modern family planning.
Oh yeah, waka go color be the better one. We go fit your body today. Cause say we get one way correct for you and your partner.
Sabi the correct thing wey family planning they do. Follow talk family planning with your partner. Waka go do family planning. Get it together. Get it together. Join hand plan your family for tomorrow way better. Now the Lagos State Ministry of Health and Primary Health Care Board, they bring una this Get It Together tori.
ọlọ́gbọ́n kó o sì ṣètò ìgbé ayé tó dára fún ẹbí rẹ.
ní ìmọ̀ nípa ìfètòsọ́mọ bíbí òde òní tó fọkàn ẹni balẹ̀ àti pé ó ń so èso rere, ìwọ àtolólùfẹ́ rẹ lè jọ pinnu àkókò tẹ́ fẹ́ bímọ.
o lè jíròrò pẹ̀lú olólùfẹ́ rẹ, jẹ́ kí wọ́n mọ̀ pé o faramọ́ ìfètòsọ́mọ bíbí òde òní kan.
lọ fún ìlànà ìfètòsọ́mọ bíbí òde òní lónìí. ìlànà kan wà tí yóò bá ìwọ àtolólùfẹ́ rẹ lára mu.
mọ kókó nípa ìfètòsọ́mọ bíbí, bá olólùfẹ́ rẹ sọ̀rọ̀ nípa ìfètòsọ́mọ bíbí, lọ fún ìfètòsọ́mọ bíbí, tó gbogbo ẹ̀ papọ̀ fún ọjọ́ ọ̀la tó dára. Ìkéde ìfètòsọ́mọ bíbí yìí wá láti iléeṣẹ́ ètò ìlera ìpínlẹ̀ Èkó àti àjọ tó ń mójútó ètò ìlera alábọ́dé ní ìpínlẹ̀ Èkó.
Sabi and make una plan well.
Know the facts. Modern family planning methods are safe and effective. You and your partner can plan when to have a child.
Talk to your partner. Let them know you support using a modern family planning method.
Go! Get a modern family planning method today. There's a method that is right for you and your partner.
Know, talk, go. Get it together. Get it together for a brighter future. This Get It Together campaign is brought to you by Lagos State Ministry of Health and the Primary Health Care Board.
Make you sabi, make una plan well.
Learn correct information about different kind of family planning method. Then they safe and they work well. You and your partner fit plan when una like to born pikin.
Tanda well, make you yarn with your partner. Make them sabi say you support modern family planning.
Oh yeah, waka go color be the better one. We go fit your body today. Cause say we get one.